This video demonstrates successfully suctioning an open system tracheostomy. Wipe off bedside table with antimicrobial wipe. Perform hand hygiene with sanitizer. Identify the patient with 2 identifiers, name and date of birth. Hey, Miss Susan, I'm going to be doing your trach suctioning today. Can you give me a thumbs up if your name is Susan Smith and your birthday is 7/26/59?
Do you have any allergies?
Verify orders in computer.
I'm looking at my orders and there is an order for trach suctioning.
Verbalize assessment and rationale for suctioning, such as breath sounds, O2 saturation, respiratory rate, effort, and pain before suctioning.
So Ms. Susan, I'm hearing that you have some secretions in your lungs. Your respiratory rate and your effort is also a little increased. So I'm going to suction out your trach. Are you having any pain right now? All right, so when I suction, I'm going to use a catheter to go into your trach. It will probably make you cough, but just for a few seconds to get the secretions, and then we'll take a break in between suctioning, and you just tell me if you're having any pain or uncomfortable.
Place clean towel over patient chest. Adjust the bed to a comfortable working position and lower rail on working side. Turn on suction to 100 to 150 millimeters of mercury. Attach manual resuscitation bag to oxygen source and set oxygen at 15 liters. Put on gown, mask, and goggles. Open suction package using sterile technique. Carefully remove the sterile container, touching only the outside surface. Set it up on the work surface and pour sterile saline into it. Don sterile gloves. With dominant gloved hand, pick up sterile catheter. Pick up the connecting tubing with the non-dominant hand and connect the tubing and suction catheter. Wrap remaining catheter around hand to ensure tip remains sterile. Remove trach collar and, using non-dominant hand, hyperventilate patient by attaching resuscitation bag. Deliver 3 to 6 slow breaths and allow patient time to exhale between breaths. Replace trach collar. Moisten the catheter by dipping it into the container of sterile saline. Occlude Y port using non-dominant hand and check suction. Using non-dominant hand, remove oxygen source from patient. Using dominant hand and maintaining sterility of catheter, gently and quickly insert catheter into trachea. Advance the catheter 4 to 5 inches. Do not occlude Y port while inserting the catheter. Apply suction by intermittently occluding the Y port on the catheter with the thumb of your non-dominant hand, and gently rotate the catheter as it is being withdrawn. Do not suction for more than 10 to 15 seconds at a time. Replace oxygen delivery device using your non-dominant hand and have the patient take several deep breaths.
Take several deep breaths.
Flush catheter with saline. Assess the effectiveness of suctioning and repeat as needed according to patient tolerance. Wrap the suction catheter around your dominant hand between attempts. Either suction the oropharynx after suctioning the trachea or verbalize assessment and determination that the patient does not need their mouth suctioned. Do not reinsert suction catheter into the tracheostomy after suctioning the mouth. When suctioning is completed, remove gloves from dominant hand over the coiled catheter, pulling it off inside out. Remove glove from non-dominant hand and dispose of gloves, catheter, and container with solution into the appropriate receptacle. Assist the patient to a comfortable position. Raise bed rail and place bed in the lowest position. Turn off suction and manual resuscitation bag oxygen source. Remove remainder of PPE and dispose of used supplies. Remove towel from patient's chest and perform hand hygiene. Verbalize patient's respiratory assessment, including respiratory rate, effort, oxygen saturation, and lung sounds.
My patient's lung sounds are now clear. Her respiratory rate is 16. Her effort is easy. Her oxygen sats are 98, and she is feeling a lot better.
Verbalize documentation, including amount, color, consistency, odor, attempt times, and patient tolerance.
I'm documenting that I sectioned my patient one time. The amount of her secretions was a moderate amount of white, thick secretions that did not have an odor, and the patient tolerated it well.
Maintain sterility throughout procedure.